Yes, so last meeting, I introduced the clinical applications of the non-selective natural catecholamines. As we remember, these are direct acting, the non-selective ng mga natural catecholamines we have. Epinephrine, we mentioned its clinical uses, clinical applications, saan siya indicated. So it is a first-line cardiac stimulant. At the same time, first-line agent for anaphylactic shock. It's also a local vasoconstrictor. Usually in a clinical setting, it is combined with lidocaine. During dental extraction naman, yung pinanggagamitan niya. And then what else? It is also used yung prodrug niya, yung preparation, special preparation of epinephrine, its prodrug, dipibefrin. It is also used naman for glaucoma. Particularly, yung mechanism niya to treat glaucoma is via enhancing the outflow of aqueous humor, thus restoring the balance between inflow and outflow para ma-reduce, diba, yung aqueous humor. Okay? So those are the clinical applications of epinephrine. Sige, we'll continue. This time, let's talk about the clinical applications of norepi. Norepinephrine naman, or noradrenaline, this is the first line agent for septic shock. So this is another shock condition. So kumbaga, yung effect dito or manifestation observed among patient is also hypotension. Diba, as we recall, kapag ang patient is at shock state, yung underlying effect dyan, ano yung nangyayari sa pasyente, hypotensive at that state yung pasyente, mababa yung blood pressure. So, septic shock is also another example ng shock condition, but this time, it's a septic shock. Kapag septic shock, the cause of septic shock, the hypotension, no? That is caused by an infection. So usually caused by bacterial infection, for instance. Okay, so yan yung septic shock naman. Again, if the shock condition is caused by infection, halimbawa bacterial infection, then that's septic shock. Now, why is it norepinephrine can be used in this condition? You relate it to this, no, yung effect na hypotension. Since norepinephrine has affinity, it has receptor activity to alpha-1 receptor, so it causes vasoconstriction. Meron siyang vasoconstricting effect, thus enhancing blood pressure. Okay, so it counteracts the hypotension effect. Next, let's have dopamine. Ang dopamine naman, it is used in the management of cardiogenic shock. So another shock condition, but this time, kapag sinabing cardiogenic shock, the cause is heart failure. Okay? The problem is heart failure. Again, kapag cardiogenic shock, it is caused by the shock condition, it is caused by heart failure. Now, particularly, ang dopamine, hindi siya first line, hindi naman nakalakay, di ba, na first line siya, but instead, alternative siya, alternative agent for cardiogenic shock. We actually have another drug, yun yung ginagamit as first line for cardiogenic shock. Yun yung dobutamine. So mamaya, we will be learning about dobutamine. Iba naman yung classification niya, though it is also a sympathomimetic. Okay, so can you take note, dopamine can also be used in the management of cardiogenic shock. Alternative nga lang siya, alternative agent. Iba yung first line. Okay, then another uses ng dopamine, it can also be used for congestive heart failure, CHF, that's congestive heart failure. So as you observed, parehas ang cardiogenic shock at saka yung CHF, parehas heart failure yung problema. Okay, so what is the problem ba kapag heart failure? So the heart is failing to contract well. So kumbaga reduced yung contractility ng puso. Hirap yung puso mag-contract. Mahina yung puso mag-contract. Okay, so kumbaga mababa yung kanyang inotropy. Okay, kasi 'di ba kapag inotropy, strength, force of contraction. So yan yung problema kapag heart failure. Okay, so with the action of dopamine, bakit pwede siya to counteract the reduced contractility happening during heart failure? It's because of its receptor activation to beta 1 naman. Okay, meron siyang affinity to beta 1, di ba? As we recall, kapag ang isang gamot could activate, stimulate beta 1 receptor, then cardiac acting yon. Particularly, it could stimulate the heart's effects. Thus, kaya niyang i-counteract yung reduced contractility, i-counteract niya yung reduced inotropy. Kasi receptor activation to beta 1 that results to positive inotropy effect. Okay, so pwede si dopamine to counteract these conditions, cardiogenic shock and also CHF. Okay, so these are the clinical uses for the endogenous catecholamines. Again, kapag endogenous catecholamines, we have NED, norepinephrine, epinephrine, and dopamine. And these are non-selective. Based sa kanilang selectivity na classification, non-selective sila, they could bind to more than one na general type of receptor. Pwedeng both alpha, beta, or pwede for dopamine, kasali yung dopaminergic receptor. Next, let's proceed to the clinical uses naman still ng mga direct-acting sympathomimetics but those selective. Okay, selective na mga direct-acting sympathomimetics. So we have, again, phenylephrine and methoxamine. These are particularly alpha-1 selective, diba, na mga agonists. As we remember, diba, meron tayong separate slides on the different drug names. You try to scan the slides on alpha-1 agonist na mga halimbawa, diba, phenylephrine and methoxamine are good examples ng alpha-1. Specific lang sila sa alpha-1 activation. So, saan ba sila clinically useful? So, they are being marketed as nasal decongestant. And then we also have preparations ng alpha-1 agonists as ophthalmic decongestant. So, halimbawa, si phenylephrine, very common, di ba nga, ginagamit siya sa mga nasal decongestant preparation. Kasi nga, pwede siya to treat nasal congestion. Yung problema ulit kapag congested, yung nasal mucosa, nagkakaroon ng swelling, the underlying cause, it's because of the dilation. Blood vessel dilation in the nasal mucosa, kaya nagkakaroon ng swelling, redness. So to counteract that nasal congestion, we need constrictors. Okay, and phenylephrine, since it is an alpha-1 agonist, meron siyang vasoconstriction nga effect. So, pwede siya as nasal decongestant. Then, we also have preparations ng alpha-1 agonist ginagamit as ophthalmic decongestant. So, halimbawa, yung condition na ophthalmic hyperemia. Okay, na-mention yan, di ba, sa previous na mga slides. Pwede ang mga alpha-1 agonists doon. Or yung conditions na nagkakaroon ng red eyes. Okay, red eyes. So, yan. So, yung pinanggagamitan ng mga ophthalmic decongestants, pwede sa condition na to, red eyes. And usually, sa mga preparations to treat red eyes, mga alpha-1 agonists yung gamit or yung, kumbaga, component ng mga ophthalmic decongestants for red eyes. Okay? So, bakit alpha-1 agonists ulit? What causes the redness sa eyes? Again, it's because of blood vessel dilation. Kaya mabilis yung flow ng blood on that area, on that vessel sa conjunctiva ng eyes, halimbawa. Kaya nagkakaroon ng redness sa eyes, nagkakaroon ng swelling. Ayan. So, to counteract that, kailangan ulit ng vasoconstriction. Vasoconstrictor, particularly. So, alpha-1 agonist, pwede yun. So, example ng available sa market for red eyes, yung IMO. I believe you have heard about that. Yung medication na IMO. diba? That is used for the treatment of red eyes to relieve red eyes. And when you check the generic name or yung component, ingredients ng eye mo, alpha-1 agonist yun. Yung generic name niya actually is tetrahydrozoline. Tetrahydrozoline. It's an alpha-1 agonist. So it's a vasoconstrictor. What else? Meron din tayong mga alpha-1 agonist na clinically useful as mydriatics. Clinically useful as mydriatics. So I know you have heard about this term, yung mydriasis. So may relationship siya to that mechanism, yung mydriasis. So mydriatics, yes, it has the ability no to dilate pupil. Yan. So related yan, 'di ba, kapag inactivate natin yung alpha-1 receptor. So kapag mydriasis, dilation yun ng pupil. So we also have that group of drugs, mga alpha-1 agonists na yung gamit naman nila is mydriatics. So saan naman ginagamit yung mydriatics? When is it used? Sino yung mga tao, patients na advised to have these medications, no? Na kailangan silang mag-instill ng mydriatics sa kanilang mata. This agents is actually used during retinal exam. Okay, during retinal examination, periodic retinal exam. So kapag ini-examine yung retina ng mata, okay? Now, sino ba yung mga patients, group of patients that are advised, recommended to undergo this retinal exam? Yun yung mga patients diagnosed with DM. Yung mga may diabetes mellitus, 'di ba? As we all know, maraming complications kapag ang patient diagnosed with diabetes. Isa sa mga complications doon is yung blindness, pagkabulag. Okay? Blindness could be one of the long-term effects, complications associated with this condition, diabetes. Okay? So, usually yung mga kailan ninyo na ay diagnosed with diabetes, meron yan silang mga proper monitoring, lalo na kapag yung stage ng diabetes niya, prone na siya or may threat na ng pagkabulag. Okay? So, the doctor will know naman kung may threat na ng pagkabulag ang pasyente having DM, kaya magreklamo man na ang patient nga medyo blurry na ang iyang pananaw, so on and so forth. So kapag may threat na ganoon, na potential na pwedeng mabulag yung patient with diabetes, then he or she will be advised to do periodical retinal exam. Okay, so kung saan mag-i-instill ng mydriatics sa kanyang mata, gina-instill na siya by drops no sa mata para makita full-blown no yung retina. Kasi kung titingnan yung mata, anatomical structure ng mata, as we remember, di ba? If that is the eye, meron siyang anterior at saka posterior portion ng mata. Ang retina kasi, makikita siya sa posterior, sa likod na portion ng mata, sa posterior structure ng eyes. So kung typical lang na device yung gagamitin to check, examine the retina, medyo hindi natin siya ma-examine full-blown. Kasi nga nasa sa posterior portion ng mata. So in that case, we need agents, no, para mas makita natin, mas ma-examine natin yung retina which is found on the posterior. Kasi ang realization man gid ana, kung nasa sa posterior part, pwede siya matabunan sa mga structure nga naa sa anterior portion ng mata. Good example is pupil. No, ang pupil ng mata nasa anterior portion. Okay, na siya sa anterior portion. So, pwede niya masalipdan ang retina na nasa posterior portion. So, yung gagawin para fully ma-examine, buo ma-examine yung retina, kailangang mag-adjust si pupil. Kailangan natin siyang ibuka using mydriatics. Kailangan natin siyang i-dilate para mas makita, no? Mas ma-examine well yung retina. Okay, so yan yung pinanggagamitan ng mga mydriatics during retinal exam. Binubuka yung pupil para mas full-blown, makita ng buo yung retina. Okay? So yan yung mga clinical uses ng alpha-1 agonists. Next, we also have those alpha-2, the presynaptic particularly, presynaptic alpha-2 agonists. Yun yung clonidine, methyldopa, guanfacine, guanabens. Ano yung clinical uses nila? They are used as antihypertensives. Diba? As we recall, ang mga agonists of presynaptic alpha-2, they enhances autoregulation. Ano ba yung nangyayari sa norepinephrine levels kapag auto-regulation? Nade-decrease nila, di ba? Yung further release ng norepinephrine. Kaya negative sympathetic effect, meron silang vasodilation effect. Thus, they can be used to treat, to manage hypertension. So, mga anti-hypertensives, yung presynaptic alpha-2 agonists. Yan yung gamit nila clinically. Next, apraclonidine and brimonidine, sila naman yung mga alpha-2 agonist pa rin but postsynaptic. Okay, alpha-2 agonist but postsynaptic yung action nila ha. Postsynaptic alpha-2 agonist sila. So nakalagay dito, treatment for glaucoma. So you already have an idea ano yung mga mechanisms, how to treat glaucoma, how to restore the balance between inflow and outflow ng aqueous humor, diba? We could either enhance the outflow or reduce the inflow. Now, with regards to apraclonidine and brimonidine, yung ginagawa nila to treat glaucoma is to reduce inflow. Magkaiba sila ni epinephrine. Kasi yung sa epinephrine, it enhances outflow para ma-restore, di ba, yung balance. Dito naman, ang postsynaptic alpha-2 agonist decrease reduced inflow. Okay, next. Isoproterenol. This is another direct acting sympathomimetics particularly. It acts to beta agonists or beta receptors. So, non-selective naman ito. Non-selective nga beta agonists kasi it has affinity to beta 1 and also beta 2. So, non-selective siya being a beta agonist. Okay, being a beta agonist. So, as reflected sa kanyang clinical uses, pwede daw siya gamitin as bronchodilator. So, no problem kasi it's quite easy to understand bakit pwede siya gamitin, di ba, as bronchodilator kasi meron siyang receptor activation to beta 2 receptor in the bronchioles. So, bronchodilation ang yung effect associated with it, with this drug. Okay? Then, the other use ng isoproterenol, it could be used to treat, counteract AV block or atrioventricular blockade. Ano ba yung problema kapag AV block? Yung problem dito is negative dromotropy. Naalala yung conduction velocity, yung rate ng heartbeat. Yun yung related sa dromotropy. So yung problema kapag AV blockade, reduced or decreased yung dromotropy. Okay, so with isoproterenol, since it has receptor activation to beta 1, it could stimulate, counteract, no, the negative dromotropic effect caused by AV block. Kasi yung gagawin niya, i-activate niya yung beta 1 causing positive dromotropy. So it counteracts. The problem to okay, with regards to its bronchodilator action, kindly take note, itong action niya towards beta 2, historical na lang ito. Kumbaga, obsolete na, hindi na siya ginagamit as bronchodilator. So historical, meaning long time ago lang siya ginagamit as bronchodilator. But ngayon, nowadays, hindi na siya ginagamit. It's because of its associated cardiovascular nga mga adverse effects. Meron kasi siyang cardiovascular associated nga mga side effects or adverse effects. Particularly, may kaakibat siya na tachyarrhythmias nga action. Okay, or adverse effect. Okay, bakit may tachyarrhythmias nga action? Kasi nga, 'di ba, meron siyang positive dromotropic effect. So without monitoring, kapag hindi na monitor yung isoproterenol, maraming cases before na nagkakaroon ng tachyarrhythmias yung pasyente. Kaya hindi na siya ginagamit as bronchodilator. Okay? Hindi na siya ginagamit as bronchodilator kasi mas maraming concentrations ng gamot ng isoproterenol na napupunta sa beta 1. Okay, mas maraming napupunta sa beta 1. Instead of yung gusto sana natin is yung bronchodilating effect niya, dapat doon sana sa beta 2 activation. Pero kahit gamitin nga siya as bronchodilator, merong kaakibat na cardiovascular side effects. Okay, so historical na lang to hindi na siya ginagamit ngayon as bronchodilator because of tachyarrhythmias nga side effects. Next, we also have the butamine. So ito yung beta 1 na agonist, beta 1 selective. So it has only affinity to beta 1 receptors. Isa siyang beta 1 agonist. So meaning to say, based on this information, masasabi natin na cardiac acting yung dobutamine. Okay, cardiac acting siya. Kaya nakasulat, first line agent for cardiogenic shock. Okay, first line agent. Ito yung first line. Then alternative naman yung si dopamine kanina na mention natin sa previous slide. And then also, used siya for the management of acute heart failure. So it is somehow easy to understand because of its receptor activation na effect. Meron siyang action to beta 1, thus pwede siya to manage cardiogenic shock. Di ba yung problema kapag cardiogenic shock? Heart failure. Okay? This is caused by heart failure. So with its action to beta 1, it enhances the contractility. It enhances inotropy, for instance. So kaya niya ma-counteract yung mga heart failure, nga problem dito, ng mga conditions. Okay, so that's the uses of these drugs mentioned under direct acting sympathomimetics. Sige, to continue, we have also selective beta 2 agonists. Selective beta 2. So they have only affinity to beta 2 receptor, particularly yung unang bullet, sila yung ginagamit as bronchodilators. Diba naalala yung metaproterenol, yung salbutamol or albuterol, terbutaline, perbuterol, salmeterol, and other related drugs, ginagamit sila for bronchospasm ng mga conditions. Example, bronchial asthma. Another example, COPD. COPD means chronic obstructive pulmonary disease. So kapag kanya na mga kondisyon, yung binibigay usually prescribed to them are beta 2 agonists. So depende yan kung ano yung kailangan ng pasyente, if it is SABA, a short-acting one, or a long-acting beta 2 agonist. So we have already subclassified, diba, this list of drug names under beta 2 agonist, under bronchodilator. So kindly scan it over sa inyong previous notes, saan dyan yung sabas, saan naman yung labas. Kindly add also here bombuterol. Okay. Next, we have Ritodrin. And kindly delete here, Torbutalin, kasi hindi na siya ginagamit no as um, uterine relaxant here kasi off-label na. Yung gamot na to, off-label. Again, hindi na siya ginagamit as uterine relaxant. Instead, bronchodilator lang yung gamit na. Yeah. Okay, and then isoxaprine. So, kindly take note, we have Ritodrin and isoxaprine. Sila, gamit nila to relax the uterine smooth muscle. So, ano ba yung gamit ng mga uterine smooth muscle? Used for the management of preterm labor or premature labor. And we have general names, diba, ng drugs when it is used as uterine relaxants. It starts with letter T. Anong tawag natin? Sa mga uterine relaxants like Ritodrin or isoxaprine, di ba tawag natin din is mga tocolytics. Yan din. So tocolysis, tocolytics, relaxation of uterine smooth muscle. So for premature labor, management of premature labor. Okay, so those are the clinical uses of direct-acting sympathomimetics. So para hindi mawala sa slides, and sa discussion, again, under direct-acting sympathomimetics clinical uses, we were able to discuss those clinical applications ng mga natural catecholamines, sila yung mga non-selective. And then we discussed the clinical applications ng mga selective direct-acting sympathomimetics, yung selective to alpha receptor, selective to beta receptor ng mga agonists. Okay, so done with direct acting. Next, let's talk about the clinical uses naman of indirect acting sympathomimetics. Diba? Under indirect acting, we have those releasers, and then we also have the reuptake inhibitors. Yun yung dalawang classes ng sympathomimetics, releasers and reuptake inhibitors. Okay, so let's focus on the clinical uses. Ano yung mga clinically useful na mga indirect acting sympathomimetics? So we'll start with releasers. So for amphetamine, and kindly add here, yung methylphenidate, amphetamine and methylphenidate, both of these agents are used for the treatment of ADHD, yung attention deficit hyperactivity disorder, kung saan yung pasyente becomes inattentive, very impulsive, very hyperactive. So, very common siya among children, although meron din namang adults na merong ADHD. So, for these drugs, being a releaser, yung first line dito is yung methylphenidate. First line. Again, ang first line for ADHD is methylphenidate. And then yung amphetamine naman, it is used as an alternative. Okay, so both are clinically useful for this condition. Next, methamphetamine, it is also useful naman for ADHD, but hindi na siya significantly ginagamit ngayon for this condition kasi nga methamphetamine, as we recall, it is also known as shabu. So, kumbaga, habit-forming siya, addictive siya. So, kumbaga, kumbaga, abused siya nga drug. So, hindi na siya ginagamit for that condition. Okay? So, yan yung uses no, for this three agents. Other releasers, yung clinical uses nila, for example, phenmetrazine, sabi dito, uses anorexant. Anorexant meaning it affects the appetite of a person. Diba? Particularly, it causes suppression ng appetite. So, it is an appetite suppressant. Okay, so yan yung anorexant. Yan yung use ng phenmetrazine. Appetite suppressant siya. And then also a popular drug of abuse, just like methamphetamine. Okay, so that's the use of phenmetrazine. Ang methylphenidate, we mentioned this already, first line for ADHD. And then modafinil naman, used for the treatment of narcolepsy. used for the management of narcolepsy. Yung narcolepsy na condition, ito um, yung pasyente is experiencing sudden fall of asleep, sudden fall of asleep. Okay, yung biglang nakakatulog yung patient, no, yung tao. Let's say, kakausap mo lang siya, then in just milliseconds, biglang nakatulog. Hindi siya literal, no, na pass out, na nakuyapan, dili lahi na siya, lahi po ng nakuyapan. Yung dizziness, lahi na siya. Ang narcolepsy is really a neurodevelopmental condition na yung tao suddenly nakakatulog siya. Okay, any situations, kahit anong situations pa yan, basta mukalit lang siya katulog, narcolepsy yun nga condition. Okay? So that's the use naman of modafinil for narcolepsy. Kasi yung modafinil being a releaser, meron siyang arousal effect. Okay, meron siyang arousal effect. Kaya pwede siya. Okay, to manage this condition. Okay, what else? Before we proceed to reuptake inhibitors, let me add here as well na meron din tayong, generally speaking, no, may mga indirect acting sympathomimetics, yung mga releasers specifically, may mga preparations na ginagamit for party drug. Maybe you have heard about party drugs, yung mga party goers sa um, sa Manila, for instance. Diba, may mga group of people na they tend to take party drugs. Good example is yung ecstasy. Maybe you have heard about this. Ecstasy is actually a derivative of amphetamine, or this is also chemically known as MDMA or methylene methamphetamine. Okay, now, with regards to ecstasy, bakit ba siya ginagamit as a party drug? It has something to do with its action. Di ba, kapag sinabing releaser, napapa-enhance niya yung level ng norepinephrine. Di ba? Again, yung releaser dyan na word, mechanism, is it has something to do with the exocytosis of norepinephrine. And as we all know, norepinephrine is the principal neurotransmitter of sympathetic nervous system. And it is a catecholamine. Catecholamine is non-selective when it comes to receptor activation. So it could activate alpha-1 or it could activate, halimbawa, beta-1. Ano ba yung purpose bakit nagtitake sila ng party drugs? Syempre sa parties, yung gusto natin, we should have enough energy to socialize, enough energy to get into party, mga walang hiya, di ba? Kapag nasa party. So for that reason, nagtitake sila ng party drugs para alive sila during the ongoing party. So with this effect ni ecstasy, for instance, napapa-enhance niya yung activity ng alpha-1. As we recall, ang alpha-1 receptor activation, di ba? Yung ultimate effect niya is napapataas niya yung blood pressure, so hypertension, yung net effect because of vasoconstriction caused by alpha-1 nga receptor activation. What else? Sa beta-1, kapag maraming napoproduce na norepinephrine, and let's say nagbind doon sa beta-1, saan ba makikita yung mga beta-1 receptor? Halimbawa sa puso. And that causes positive inotropy, positive chronotropy. So positive lahat, no? So it stimulates the heart. It causes cardiac stimulation. Kaya talagang without knowing, hindi alam ng tao, take siya ng ecstasy, hindi niya alam na napapa-enhance yung sympathetic effects, thus leading to death. Pwede talagang maka-cause ng death yung mga party drugs. Okay? So yan yung use, no, ng ecstasy, and usually Ang party drugs, mga indirect acting sympathomimetics yun sila. Okay, so yan for releasers. Then let's proceed to reuptake inhibitors. We have cocaine, atomoxetine, and sibutramine. Ang cocaine, just like lidocaine, it is also a local anesthetic. Important information about cocaine is that it is only the local anesthetic that causes vasoconstriction. Okay, again, it is the only local anesthetic that causes vasoconstriction. The rest of the local anesthetics available, vasodilating yung action nila. Kaya nga yung lidocaine, diba? When we discussed about lidocaine, talagang it is being combined with epinephrine para may local vasoconstriction, yung effect ng buong preparation. Okay, so yan yung important information about cocaine. Yung atomoxetine, treatment din siya for ADHD. Then sibutramine, treatment for obesity. So kumbaga, parehas sila ng phenmetrazine. It is used as anorexian. Okay, anorexian, kumbaga appetite suppressant din yung sibutramine. Okay, so those are the clinical uses of indirect acting sympathomimetics. We have the releasers and ito, reuptake inhibitors. And then lastly, let's talk about the clinical uses naman ng mga mixed sympathomimetics. So we have ephedrine. So nakasulat dito, clinical use to treat narcolepsy, yung sudden fall of sleep ng tao. Then mephentermine and metaraminol, treatment for hypotension. That is because these drugs, they have direct action also to alpha-1 receptor. Kaya pwede siya to manage treatment or to treat hypotension. And then we also have phenylpropanolamine. It is used as decongestants in oral OTC drugs. A good example of an OTC or commercially available decongestant with this component, phenylpropanolamine, is yung Decolgen. Decolgen Forte, yung non-drowse, Decolgen, both preparations, they contain phenylpropanolamine, and yes, yung use niya being a mixed sympathomimetics is as decongestant kasi meron din siyang affinity towards alpha-1. So may vasoconstricting effect siya. Kaya pwede siya as nasal decongestant. Yun, Decolgen, for example. Okay, so yun yung mga clinical uses class ng mga sympathomimetics. So na-discuss natin yung applications, indications ng sympathomimetics from direct acting, indirect acting, and ito, mga mixed sympathomimetics. Okay, then the last part for sympathomimetics, let's talk about their adverse effects, the common one, or yung mga potential na mga side effects associated to them. Okay, so we'll start with catecholamines. By the way, when we talk about adverse effects, ito lang din yung related to their mechanism of action. Related to their mechanism of action. So somehow, if you are knowledgeable enough to the receptor activations of those drugs, then you can easily oversee or foresee or predict ano yung potential na side effects, adverse effects ng gamot na yan. Kasi ang nangyayari kapag adverse effects, there is only an extension of its mechanism of action, may extension, may prolongation sa kanyang effect. So halimbawa, mga catecholamines. Diba? Yung knowledge natin about catecholamines, these are non-selective when it comes to receptor activation. They have affinity to alpha and beta receptor. So therefore, kapag talking about adverse effects ng catecholamines, ang mangyayari lang, there will be extensions of those alpha effects we have learned, extensions of beta effects that you have learned. Okay, sige, let's have, for example, alpha. A good example ng alpha, extension of alpha action or alpha effects is yung persistent nga blood vessel constriction. Diba? Blood vessel constriction. Naalala kapag alpha 1, for example. Extension of alpha 1 effects, of course, blood vessel constriction. But what is the net result kapag may extension, prolonged constriction of blood vessels? Possible nga being affected, pinaka-affected dito is yung mga digits, yung mga, halimbawa, yung fingers. Okay, yung mga blood vessels sa fingers, particularly. And that causes digital necrosis. Okay, again, because of the persistent blood vessel constriction, that could ultimately cause this adverse effect. Adverse effect na to kapag nagkakaroon na ng digital necrosis. As you understand the term necrosis, it means cell death. So namamatay yung mga tissues, mga cells sa digits. Digits in anatomy, that's also the fingers or yung toes. Okay? So sa digits natin, if may constriction, prolongation ng constriction of the vessels in the digits, pwedeng magkakaroon ng limited supply ngayon ng nutrients doon sa finger. So limited ngayon yung nutrients, limited blood na nare-receive sa digits, sa fingers, that will cause cell death, no, sa digits. Kaya necrosis. Necrosis means cell death. Okay? Kaya usually, ang best monitoring when a patient is given catecholamines therapy, kanang mga under sa catecholamines nga therapy nga mga pasyente, tinitingnan also yung digits, yung mismong mga fingers. Tinitingnan yung kuko, halimbawa. Kapag na-violet na, nag-violet na yung kulay ng kuko, that could be an indication na adverse effect na yun ng gamot na tinitake niya. Okay, kasi namamatay na yung cells sa fingers or sa digits. So that's digital necrosis. And then beta actions, example, syempre yung pinaka-compromise dito nga organ ng katawan kapag may extension of beta action is yung sa puso, di ba? So pwedeng ang adverse effects sa upon extension of beta action is tachyarrhythmias. Okay, tachyarrhythmias. So pwede yung adverse effects with extension of beta actions among catecholamines. So 'di ba? You can somehow predict its adverse effects kasi may relationship lang siya sa mechanism of action. Okay, so it will still boil down to your knowledge foundation on receptor activation. You really have to master the receptor activation para you could easily understand the MOA and at the same time the adverse effect. Okay, in some cases, there are also CNS disturbances as adverse effects. Particularly, this is observed among non-catecholamines. Mga non-catecholamines. And it makes sense kasi between the two, catechol versus non-catecholamines, ang kaya lang mag-penetrate sa CNS, ang kayang ma-absorb sa blood-brain barrier, are those non-catecholamines. Diba? We have learned about that. It has something to do with the structure ng catechol versus non-catecholamines. Ang mga catecholamines, because of the presence of catechol, diba, they are highly polar. So they cannot penetrate the blood-brain barrier. So yung mga non-catecholamines, sila possibly associated sila with CNS disturbances. Example, nervousness, anorexia, insomnia, anxiety, paranoid, convulsions. Okay, so yan yung mga common adverse effects for non-selective sympathomimetics. So this time, let's proceed to adverse effects naman ng selective. Okay, selective sympathomimetics, yung direct acting sympathomimetics, particularly for alpha-1, beta-1 agonist, and beta-2 agonist. So for alpha-1 agonist, pwedeng yung associated adverse effects nila has something to do with increasing the blood pressure, enhancing the blood pressure. So hypertension, diba? It has something to do with the vasoconstriction or vasoconstricting action ng alpha-1 agonists. So extension of that effect, pwedeng mag-cause siya ng high blood, diba? Hypertension. Then beta-1 agonists, ano yung mga associated adverse effects kapag ginamit sila? It has something to do with cardiovascular conditions. Diba? Associated siya with cardiovascular adverse effects. Kasi nga beta-1, compromise dito nga organ sa katawan would be the heart. So it might cause tachycardia, arrhythmias, tachyarrhythmias. Okay, so may relationship lang siya sa MOA ha. I-relate nyo lang siya sa MOA. Then beta-2 agonist, pwedeng yung adverse effect, very common, the patient is experiencing tremors. Diba? Pinaka-good example dito is yung mga pasyente under salbutamol therapy, kanang nebulize with salbutamol. No? Mga asthmatic patient. So under sila, diba, sa salbutamol therapy, for instance. There are patients na kapag nagne-nebulize sila, naa sila'y sudden tremor nga ma-experience. Yan, adverse effect yun ng gamot. Okay, as we recall, meron ding mga beta-2 receptor, di ba, sa neuromuscular end plates, and kapag na-trigger yun, yung beta-2 receptor doon na-activate, tremors happen. So, adverse effect ito with beta-2 agonist. What else? Yung effect niya sa potassium levels in the blood. Diba? Kapag beta-2 agonist, associated na adverse effect niya is hypokalemia din. Baba yung potassium ion level. So it has something to do with activation of beta-2 receptors sa skeletal muscle cell membrane, yung uptake of potassium ion. Yan. Related yun doon. So yan, adverse effect yan. Okay, then we have cocaine. Cocaine is a mixed acting ng sympathomimetics. Okay? So, yung adverse effect naman niya are cardiac arrhythmias, infarction, and convulsions. Okay? So, we are done with adverse effects or toxicities ng mga sympathomimetics. So, balikan natin. Under sympathomimetics, we were able to finish discussing them. Ano yung flow ng discussion natin on sympathomimetics? We started with the classes of sympathomimetics. Yun yung based on chemistry, then based on MOA. And then, what else? After we discussed the classes, we talk about the names, yung mga examples, mga drug names. Dito papasok yung mga drug names under direct acting, indirect acting, and mixed acting. And then next, we discuss about the uses, the clinical uses of these sympathomimetics. And then finally, we discuss about adverse effects. So yan yung naging flow natin in discussing sympathomimetics. Okay, the same flow will be used when we discussed about antagonist or sympatholytics. Ganun ta rin. We will start with the classes, then the drug names, clinical uses, and adverse effects. Ganun din yung flow under cholinergics, mga cholinergic drugs, the cholinomimetics, and cholinolytics. Okay, so during your independent time study, you can make use of this outline. So you can have a separate note sa inyong paper, and then have this kind of outline para when you do kanang mag-recall or check if you retain what you have studied, you can make use of this outline lang. Ano ba yung mga under sa classes? Based on chemistry, we have catecholamines, non-catecholamines. Under MOA, ano yung naaral natin? Then sa names, sa examples. Diba? Ganun din yung magiging flow. Okay? So you can make use of this outline para mas organize yung thought nyo, longer nga retention sa topic on sympathomimetics. Okay? Do you have any question about the discussion?